A catheter strapped to the underside of a dog's belly is a surefire indication of an issue with the urinary tract, in this case, an obstructed bladder. A fairly common occurrence in dogs, this video hopes to explore a little more on the topic of urinary tract infections and bladder obstructions, through the case of this 14-year-old mixed Shih Tzu. This is a Be Kind to Pets veterinary educational video sponsored by Toa Payoh Vets, where veterinary medicine and surgery come alive to vet students and pet owners. Today is the 12th of October 2019, Saturday. This here is a 14-year-old male mixed Shih Tzu. This dog is suffering from the inability to urinate as a result of obstruction in his urinary tract. During insertion of the catheter as shown in this picture, it was noted that sand-like crystals were obstructing the urinary tract and is a possible culprit for the dog's problems. These were soon discovered to have been ammonium urate stones. Unfortunately, this has been a recurring issue for this particular dog, and it is not the first time it has visited the clinic. Before diving further into the case, let us explore a little more about the dog's history. In September 2017, the Shih Tzu had visited a previous vet as he had experienced difficulty in urinating, a condition known as dysuria. The vet had operated on him then to remove the ammonium urate stones in the bladder. From the X-ray results here, it can be difficult to identify the stones, largely in part due to ammonium urate stones being highly radiolucent, meaning that it is transparent to X-rays. By contrast, struvite stones are radio-opaque and would appear more obviously on a radiograph. 2 years has since elapsed, but the dog's condition has since recurred. One of the dog's most recent visits to Toa Payoh Vets took place on the 4th of October 2019 Friday, with the complaint of it being unable to urinate. As a result, Dr. Daniel recommended catheterization to allow for the obstruction of the urinary tract to be relieved and to allow the urine to be passed out. The catheter placed into the urethra proved effective, and when the obstruction appeared to have been cleared, the dog was sent home. Unfortunately, the success of the procedure was short-lived, and the dog soon returned to the clinic on the 8th of October 2019, Tuesday, with a similar complaint of dysuria. To treat the issue, catheterization was carried out once more, but with a slight change this time around. The procedure was attempted without anaesthesia this time, in order to avoid the anaesthetic risk accompanying surgery. Over the course of inpatient treatment, the catheter will be flushed and urine aspirated on a daily basis. Treatment is also supplemented with a course of antibiotics and anti-inflammatories. Furthermore, a urine culture has also been conducted to diagnose the bacteria responsible for the urinary tract infection, so as to allow for the prescription of more effective antibiotics. The success of the second catheterization, however, was also very short-lived, as the Shih Tzu continued to make multiple trips to the clinic. Every time the catheterization was performed and the obstruction relieved, the dog was able to urinate freely. Unfortunately, the problem recurs as soon as the catheter is removed, as the ammonium urate stones soon find their way back into the urethra, thereby preventing urination once more and causing the owner to bring the dog to the clinic repeatedly. While the usual treatment typically involves a surgical removal of the stones, the patient's health profile raises the anaesthetic risk considerably, thereby complicating matters. Given that the owner is not fond of such a risk, repeat catheterization seems to be the only solution for the time being. In the case of this particular dog, he has a history of ammonium urate stones previously. After the initial surgical removal of the stones by the other veterinarian, the dog's condition was maintained through a prescriptive diet. However, the owner soon stopped the diet when the dog's condition has shown improvement, resulting in a recurrence of the condition. Dr. Singh recommends dog owners to undertake a urine test, also known as a urinalysis, every 6 months for their dogs. This would allow for early detection of bladder stones and thereby increase the efficacy of treatment. Unfortunately, most pet owners do not abide by this and only send the dogs in when they experience difficulty urinating. By that point, the main treatment method narrows to just surgery alone, and as was illustrated in this case, that may not always be possible, especially in the case of older dogs. Do visit toapayohvets.com if you need more information, and once again, thanks for watching.